I remember a doctor from an African country who came walking through our warehouse one day, and she reached over and she picked up a small plastic item, and she said, "If I'd had this last week, I would have saved that baby."
They were taking gloves and washing them in a stream to make sure they can come back and use them. MedShare was founded on the fact that you had incredible surplus of medical supplies and equipment here in the United States. At the same time, you had people dying around the world because they lacked these critical supplies.
MedShare is by far and away the global leader in taking medical supplies and connecting those to NGOs in areas of need. It is a very unique model.
Our volunteers are, truly the lifeblood of the organization. They're our actual labor force. They're a very, very important part of what we do.
The materials that we collect are sorted, bar-coded, and entered into the inventory. What makes us different is that the recipients order what they need.
When an MRI machine, a CAT scan machine is delivered to, for example, a village in Ghana, MedShare trains people to use them and also trains them in how to fix the equipment.
It doesn't matter what part of the world you're in. Even here in the United States, the need is there.
When the pandemic hit, it became clear to us that there was this huge need at home, particularly for the safety net clinics.
COVID-19 has highlighted health inequities that were always there, and they're willing to jump right in and deal with it.
During March of 2020, we didn't know where we would get supplies, and MedShare was doing PPE drive, where clinics can come, you pop open your trunk, and they'll put in shoe covers, masks, face shields, hand sanitizers, and gloves. That was a huge gift to us.
In some places when I go, I shed tears. But after MedShare has stepped in, I smile.
Global problems require global solutions. You just can't do this work alone.
As the world's largest provider of products and services in the healthcare space, we are a natural partner to help MedShare taking those products and services and bringing those to areas of need.
The people at MedShare are incredible. They are so passionate, so caring, so engaged. It's a phenomenal experience to connect with them and to work side by side to solve some of the greatest challenges right now in the world.
I've been involved in a lot of nonprofits, but MedShare is the one where all the pieces line up.
One of the treasures of MedShare is that they share.
I had no dream, no idea, no inkling that MedShare would become as big and a significant player in the international aid and domestic work as it has.
It's gone on to be sustainable in its own right, both because of its reputation and because of the professional mechanisms that have been built into it.
When you think about that one box of gloves, it's not 500 gloves, it's 500 patients. It's the medical staff that's treating them.
There is incredible runway in front of MedShare to continue to grow.
We provided services to over 100 different countries, half the countries in the world. We want to get up to about 5 million people served annually, beginning the year 2026.
It's a calling, and I think it's a blessing all in one. No problem is too big if enough people care.
Where there is health, there is hope.